Oh, sorry.
I'm Andrea Mudford.
Hi, nice to meet you, Larry Nassar.
Thanks for coming in so quick, too.
Yeah.
Obviously, you're not under arrest, so you can leave whenever you want. Anytime we bring someone to the interview room, we make sure that they know that. I know you talked to Val O'Brien, one of my colleagues, a couple years ago.
Right.
That was
Okay.
what I want to talk to you is kind of go back to that situation. Sure. And I know that you guys had, papers on this, talked about maybe redoing some practices and things in relation to that. Reference that situation. What do you recall about that investigation?
Right, that had, concerns over the form of treatment that I was doing, and that I talked about having to do the reasons why I did it, from a manual medicine standpoint. And there was a student that was in the room that had to leave to start because I was behind. We need to start another patient, and so we're like, always have another person in the room.
Right.
You know what I mean? And I've been trying to adapt my techniques so we won't get into the same situation.
Okay. What practices have you changed in response to that?
I've been trying to have people in the room,
okay.
And trying obviously not to get into that same situation. You know what I mean? Like, has there been another complaint? I'm just like confused right now.
Well, we're kind of seeing what things have changed, what practices.
Okay, yeah. So I'm trying to do things where the difficulty is with the hands-on is I'm trying very hard to do things where I'm not being nearly as invasive, but it compromises things. So I am trying to modify that and having students there and having family members there, and I document in the chart, so-and-so's in the room, so my documentation's changed. I'm trying my best to do it over close, and that's sometimes the hard thing is the tightness, it's like the close gets in the way, But, so I'm very, there's not a day that goes by that I don't think about that,
Yeah.
Because that was a very scary thing, in my life, obviously. So, and I don't want to get into that. So I was like, oh my God, what happened? Like my heart is hurting. It's like what the heck? So, I hope, that I've made the appropriate changes. Because it's, and I've done a lot of education. I'm really trying hard at educating so that and I always thought I was good at educating, but I'm trying to educate even more.
What do you mean by educating?
Explaining what we're doing.
To the patient?
To the patient, family, exactly.
All right. Have you had any instances where there hasn't been anyone in the room for an exam?
There'd be some on occasion, of course. You know what I mean? That just is the way that with medicine is now. It's difficult. You know what I mean? So yes, that has happened.
In what circumstances cause that to happen?
The patient is an adult, like she was too. But again, when I'm doing that, I'm trying not to do those techniques. You know what I mean? So, but I'm trying to, really trying to explain things. And I haven't had any complaints, you know what I mean?
During that technique, though, has there been situations where someone's not in the room?
I would probably, who's a doctor, you know what I mean?
You do that technique on?
She said it saved her career, you know what I mean? So she was just in today.
Can you explain the technique? I've never been in pieces, but
and I sent her videos, too. I lecture on this. That's the thing that's frustrating. It's the sacrotuberous ligaments. It runs from the pubic symphysis, the falciform process. It's like the pelvic floor. Okay, you want to understand the stuff. So you're really coming in, like the way to describe it, even in some of the videos is, it's like you go towards the labia and go lateral. So you're going in and apart. Okay, and then there's muscles that attach to the ligament, and so as you're treating that, you can feel the release, and that's a great teaching thing too. It's like I have the student feel their rib cage, okay? And then I go and I release that, and they're like, oh my God, what did you just do? You know what I mean? Because they can feel that effect, from the way that the muscle, the costellostoracic runs down from the rib cage into and entwined in the sacrotuberous ligament,
So when you're doing that, and you said you look for the release, what are you feeling? Like, what does...
You feel tissue tension.
Okay.
Tissue tension changes. It's all about tissue tension. And so you're trying to, like if I pull on one part, You know what I mean? Like you can see how that affects another part.
Right.
So it's the same thing like a run in the pantyhose or something like that. You know, like one pull here can affect, and we talk about triplaning and fascial releases where, say if I rotate, extend, and back, you know what I mean? That like wringing out a towel. You know what I mean? So there's, you know, you may have to go clockwise, counterclockwise. I always talk about the different vector forces to make the effect above. You know what I mean? So it's a three-dimensional, you know, I call it triplane, but like a three-dimensional effect to it because it's not just that simple. You know what I mean? So.
Gotcha. Okay. Now, how long have you been doing this technique?
I have video from 30 pounds ago, from like the 1990s. I'm trying to remember. It would have been in the 1990s. You know what I mean? Like early 1990s.
Right.
You know, and I've made videos very clear. You know what I mean? And I've lectured. Oh yeah. You know, and I've lectured. And
are those online anywhere?
they're on my G drive, like I said, that I've sent. You guys should have all of that.
Dropbox or something.
Yeah, no, it might have been Dropbox
It was
then.
back then,
Yeah,
just a few years ago.
Yeah.
So how would a patient be laying to get that treatment?
Prone, and then they're lay prone, you know, and then you're doing that. And then I can do it seated. I talk about doing seated. I can do it standing. I can do it supine. So, yeah, you can do, but
Would they be on their side?
on their side?
Yeah.
Yeah, you can do it on the side, too. I mean, like I show them in all the different directions, but it's rarely on the side. It's more, if I'm doing something on the side, that's more for the SI joint. That's the SI joint.
What's the SI joint?
Sacroiliac.
Okay.
Right here, you know,
Right.
so that's where I might be like lifting. You actually sometimes like lift the hemipelvis.
Okay. And so where on their body would you touch
Your
them on
ear
the
would
other
be,
side?
if your hands are like this, you know what I mean, you could be actually holding that, like this would be up towards the back and this would be up towards the pubic symphysis, and you could be like a U shape and you can lift and shift from that position on the sideline. Generally with the sideline, that's the lift and shift and the coccyx. You know, if there's a coccygynia, you know, problem, then sideline, you know, can be treated sideline.
Okay. All right. But you wouldn't, like if somewhere on the side, you wouldn't be doing the same
There'd be an
treatment?
alteration. Yeah, it'd be a variation. You got to
Okay.
adapt, like just like standing. You know what I
Right.
mean? Like so, you change it because of the three-dimensional vector forces. Depending upon whether what position they're in, it's going to have a different effect. So normally you try it one way. If one way doesn't work, then you try to seat it. You know what I mean? Because of the way that you can affect. And I try and teach them if it works. I've taught a lot of patients how to do it themselves.
Okay.
You know what I mean? Like self-treatment. Like okay, I told them it's like giving themselves a hand wedgie. You know, it's like reach and pull, reach and pull. Like you're picking a wedgie, you grab and then you pull off to the side or you pull front, or you know, one of those three main vector forces is.
Okay. Would this ever involve like digital anal penetration?
Only if we're doing a coccyx, you know,
Right.
problem. You know what I mean? So if there's a fractured coccyx or a coccyx disorder too,
Okay.
you know, so that you can come perianal because it comes up. You know, you have the pelvic floor attachments, but you can come to the pubic symphysis and also towards the coccyx. You know, I mean, so it's your lift. I call it the lift and shift. You know, when you're doing that. You know, so that's a very common to do one side or the other, and that's the straightforward. So like if you're here, here, or here, there's three different vectors, and that would be the straight vector. Like if I'm doing ribs a lot, you know, then I would be going straight.
Okay. All right. Well, the reason I'm asking is that we did have another complaint.
Really?
Yeah. And it's a patient from a while ago.
Okay.
And she does describe some things that sound to me like they're out of the norm
Okay.
from your typical treatment.
Okay.
This would have been in,
Wow. Okay.
and she was receiving some of that type of treatment, but
Okay.
then there were also some other ways that she was touched that should
Okay.
be on the treatment.
Okay.
So that's why I'm asking about anal penetration.
Only if there'd been coccyx, and I would have, and it would have been. I mean, like, because you can push hard. There's a lot of room down there, but I wouldn't have gone intra-rectal. You know what I mean? Like, unless I was purposefully treating the coccyx itself.
Okay.
You know what I mean?
And what would you use to do that? Like, what digit or what part of your hand would you use?
Well, normally I'm using my thumbs. You know, as I'm coming up this way. You know what I mean? Then if I actually have to fix a coccyx, then I'm going to be using my finger inside and my thumb on the outside.
Okay.
You know, to
Do you wear
manipulate the
gloves when you do
coccyx.
this?
If I'm going to go intra, yes. You know what I mean? You know, so.
This was a long time ago, so I don't know how many of your patients that you remember from back
Right.
then.
Yeah, I don't, I mean, you know, how many patients, right. Yeah, no, I don't remember, you know.
Right.
You know. No.
Well, this is a little bit of a personal question, so
Yeah.
I'll just be totally honest.
Yeah.
I mean, you have these young girls in there. They're
Right.
athletes.
Right, but they're usually with their parents. They're usually with
yeah.
their, parents, you know. So that's why I explain a lot. You know what I
They're
mean?
athletes. They have
Right.
lovely figures.
Right,
They're very cute
right.
girls.
Right.
Do you ever get aroused during these exams?
Do I get aroused during the exam?
Yeah, but do you ever get an erection?
Well,
Or, I mean,
obviously you don't, you know what I mean? So
is there a reason that you would during an exam?
I shouldn't be getting an erection during an exam.
Right.
Okay.
Well, this is why I'm talking to you about this,
Yeah.
because this young girl and her mother both observed this on more than one occasion during treatment.
That I would get aroused during an
Mm-hmm.
exam.
Visibly an erect penis. Not exposed, but through your clothes.
I can't explain that because that should, when I'm working, I'm working.
Mm-hmm.
You know what I mean? So I don't.
Well, you can understand why this would be
Well, yeah.
a concern.
Yeah.
You know, that you didn't wear gloves.
Right. Okay. But I mean, but I was like doing her coccyx.
Mm-hmm.
Actually digitalize the coccyx, like for coccyx treatment.
Mm-hmm. The words that she used were, he anally penetrated me with his thumb.
No, see that wouldn't have been. See, I would never do that for the coccyx. I would use if I'm going inside, I'm using this. If I'm penetrating, it's not penetrating. It's pushing off to the
So I
side.
penetrated her. Okay. Again, this was some time ago.
Yeah, but I'm lifting up and I mean it's not going inside her rectum. It's you can get there's a lot of soft tissue there, you know, and you're lifting through there. I would be wearing gloves if and I would be using this finger. Okay, when I'm using my thumbs, I'm lifting, you know what I mean, to try and separate the tissue and releasing through there. You know,
And this is what you're describing to me is very different than how she's describing her experience.
Okay.
All right.
Okay.
That there was no explanation of what you were doing to her or to her mother. And so you can see kind of the consistency from what happened a couple years ago.
Well, no, but okay, but I mean, okay, but I would be, I mean, like, that's why I have so many lectures and stuff. I mean, that's what I'm known for is my education.
Mm-hmm.
You know what I mean? So I don't.
Your education to
students.
To students,
Right.
but not necessarily
to patients. Well, I try to. You know what I mean? Like I am. I'm like, I've never had anyone, you know, what's confusing to me about is, why wasn't there anything said back when I was treating them if they felt that uncomfortable? You know what I mean? It's like if I'm talking to the patient.
Okay, put yourself being a teenage girl.
Okay.
All right.
Okay.
Most people that are sexually assaulted are very uncomfortable. They don't know what to say.
Okay.
They're in a position where they feel.
But the
all
parent,
sorts of
the parent
emotions.
was right there. You said the mom was there.
She was in a different part of the room. She couldn't observe.
It's just.
I mean-
It's an exam room, a different part of the room. It's the same room.
Behind where you were.
Okay.
But I don't think that really the focus is why is it being brought up now. I think
Well,
the focus
I'm just
is
trying to think of what.
that it has been brought up, that
Right,
there are
right.
discrepancies in what she's
Right.
telling me as compared to the technique that you're describing.
Well, yeah, but I'm trying to think of. I mean, you know, this is. I'm trying to think of what I would have been doing differently. That's a long time ago. You know, I mean, for me to remember everything, but there would be, like I said, what the discrepancy would be is I'm using my thumbs, that's not a discrepancy, to release around the coccyx, okay, where I'm actually lifting, okay, so that's what I said, if I'm treating through sacrotuberous and not the actual, because I'm trying to release the tissues that come up to attach there, so I am pushing hard, okay, with my thumbs, okay, and I'm separating. Okay, so if you have thumbs over there and you're separating, but I'm not going in, if you're going inside you're going to be using your finger, okay, not your thumbs, and that's that's consistent with what I'm saying, with what she said. So if I'm saying yes, that I'd be using my thumbs, how's that inconsistent?
Well, if your fingers, and pardon me, gesturing,
Right.
are doing some type of...
But my fingers are up here. My thumbs are at the coccyx.
Well, that's not how she's describing it. Now, your fingers are vaginally penetrating her.
What?
And then your thumb
Uh-huh.
anally penetrates her.
No.
So I don't see where that falls in line with that technique.
Right, and I don't see how that would be accurate.
More than once, on more than one treatment.
I'm just working the floor, you know what I mean? But I would not be, how would I be putting my thumb and fingers, you know, like that? That would not be correct. You know what I mean? I am...
Now, if there's some type of treatment where she's on her side, would you have any reason to touch her breast?
If I'm treating ribs, so if I'm treating ribs, that must have been, like I said, I would have been pushing and touching ribs, okay?
How would you touch her breast to do the ribs? I mean, demonstrate on yourself.
Right, you're moving the tissue out of the way. You're moving the tissue out of the way to try and get down between the breast and the rib. Okay, so you're lifting and shifting again because you're moving the tissue out of the way. So if I'm moving tissue out of the way, I got to get down to where I'm making contact, you know, with the rib. Okay, so you try and move and adjust. Okay, or the same thing here. If I'm on the head coming down, you're pushing down, or if you're off to the side, you're pushing off to the side. But you're you know, there's ribs that are underneath that area, so you're trying to slide through and across.
I get that makes sense.
Right.
But this girl saw you 5 times,
Uh-huh.
and all 5 times there was something that, with her knowledge of what that treatment was, because she had some knowledge of it,
Uh-huh.
went beyond that. The
Okay.
touching of her, the digital penetration of her anus,
Mhm.
touching of her boob, and she could visibly see at that time that you had an erection, that you were aroused. Okay, she describes your demeanor, your behavior, your physical reactions, and being able to see an erection.
Okay.
Okay. So, you know, I know it was a long time ago.
Oh, right.
I'm here to get your side of the story because
Right.
this is very concerning.
Well, yeah. I mean, I try my best to be appropriate, professional. You know what I mean? And I have no understanding of why that would be occurring. Okay, like yeah, I'm a male. You know what I mean? But
Has it ever happened in an exam or treatment before?
you know, I mean, you are, you know, I mean, I'm focused on my treatment. You know, what I mean, I'm not trying to gain any type of sexual pleasure out of working with my patients. Okay, I mean, that's what you're trying to ensue or whatever.
That's what I'm asking you.
Right, and I'm saying no, I don't get sexual pleasure out of working with my patients. That's not what being a physician is. Not what I'm about. Okay, what I'm trying to do is release tissue and work through them, but I'm not trying to get my, you know, like my jollies out of this. Okay.
So explain to me, like when you're doing an exam, is it physically taxing on you?
Yes. Oh yeah. Any medicine is physically taxing. Yes. You know what I mean? That is, there's no question about that. You know what I mean? Because you're moving body parts and you're pushing and you're really, and for me it's a lot of cerebral where I'm trying to visualize where the fascia's going, you know, and pushing and moving. Okay, so I mean, I'm working my best to try and allow that treatment process to occur, and you're really trying to feel what's happening in the tissue. Okay, and yes, you're moving tissue out of the way. You're pushing in and separating. Okay, and you're trying to feel with one hand you're pushing, with the other hand you're monitoring to sense what's happening at the other end, and then you can compress and mobilize, but to I mean, so I could see how people could feel because there's a lot of tissue and I'm separating, but you know, I'm trying to explain things while I'm doing things. You know, are you okay? Does that make it feel better? You know, like when I push them, like, does that feel better? Is that helping? You know what I mean? Am I pushing too hard? I'm constantly discussing that with them. You know what I mean? Like, does it help?
What would you say prior to doing this treatment?
What would I say prior to doing the treatment?
You're at a doctor, someone that you trust, and all of a sudden, his fingers are essentially in your vagina.
Well,
And with no explanation.
I would have explained it. I don't understand why she said I didn't explain it, because I always explain, okay, now you're going to
But
feel
you
like
didn't
pressure.
explain it 2 years ago.
Yes, I did.
I mean, 2 years ago, she reported pretty quickly after it happened. She's not going to forget
Right,
that she
right,
received
right.
an explanation.
But I do explain. You know what I mean? That's what I'm saying is like, you know, I don't, that's I'm like, okay, I'm putting pressure, compressing, separating, you know what I mean? Like I'm going to, you know, my hands are going to be pressing on you here, and I'm going to be pushing off to the side, or, you know, if this hurts, let me know, you know, but I'm treating it and just talking at the same time. You know what I mean? So as I'm going through it, it's not like I sit and explain everything to start with and then go do it. I'm talking through it too. You know what I mean? It's like, how does that feel? I'm getting real-time feedback from them. Okay, so as I'm doing it, like, you know, is this hurt? Are you okay? You know, is that feeling better? Okay, so it's not like it's a dead silence and I'm just doing things. You know what I mean? I'm constantly talking, you know, with them to get feedback. Okay, did they say anything about that? You know. But that's what I do. I'm constantly talking. You know, does that make it feel better? Make it feel worse? And I'm adjusting based upon that.
Would there be a situation that you wouldn't wear gloves during an exam like that?
If I'm, you know, like, I will wear gloves if I'm actually like manipulating the coccyx. You know what I mean? Because you're going into rectal. You know what I mean?
What if you're going vaginally or even just outside?
Well, if I'm just outside, no. You know what I mean? Yeah, I even say that on the thing. You know, as long as you're staying external, you know what I mean? Because you're external, okay? And you're sensing, you're using to push, to lift and shift. You know, because you're staying. You know what I mean? Like you're staying lateral to that. So you're pushing in central and then lateral. Okay. So, but you know, so if you have like the vagina here and you come in here pushing, you can see how you could, you know, like feel, or they may have as a teenager having that sensation, but I'm not going intravaginally. I'm going extravaginally, but pushing in through the pelvic floor. Okay. So this is the pelvic floor. You know what I mean? You're here and coming over. There's tons of room there, okay? And so that's what I'm saying is like that as I'm doing that, I'm asking them, you know, are you okay? You know, am I pushing too hard? You know, is this hurting? You know what I mean? Do you feel better up there? Am I monitoring hand?
Do you ever ask them if it feels good?
Feel better or worse? You know what I mean? Does that feel better? You know what I mean? Are you doing okay? It's always better, you know, because I'm trying to see, okay, do I need, remember I said about the different adjustments, because do I need to go this way, or that way? It's based upon how they're responding and how I'm sensing the release, because I can sense the release, but I can't sense their pain. You know what I mean? And are you okay? You know what I mean? That's the thing that's very irritating to me, you know, is that if I'm asking the patient, you know, for feedback while I'm doing it, that's how I always feel like I'm okay, because I'm like, are you okay? Are you okay? You know, like you're talking in real time, you know, with them. Okay, am I pushing too hard? Is this hurting? You know, like this, because you know, you don't want to push too hard to hurt them. You know what I mean? So, you know, does that feel better? Feel worse? You know what I mean? And then they respond. You know what I mean? I mean, I hope. You know what I mean? So, but that's what is frustrating to me, is trying to get an understanding of why there was that lack of communication. You know what I mean? But when you're talking to them in real time, you know what I mean? Like I'm asking their feedback.
But in a situation where you weren't talking and they didn't know what you were going to do to them because they had no prior explanation, I mean, would a girl that young speak up?
When you're trying,
if she's wondering if she's not feeling okay, but she thinks it should be okay, and thinking about it later, then she realizes that it was not okay with her. I mean, there's lots of reasons why people
I can see that, you know, and
then seeing that you're erect and feeling on more than one occasion and feeling very uncomfortable.
Yeah, well, it'd be nice if I had, you know, whatever. I mean, I can't speak for her, but if the parent also and her felt that, it'd be nice if there was some communication where I'm asking for communication. You know what I mean? So, but that's...
And we can't go back to having that,
right,
but this situation as it is, I mean, there are some things that, even to me, hearing you explain it one way and hearing how she explained receiving the treatment was very different.
You know, I mean, trying to
Well,
trying to explain it, you know what I mean, the best that I can.
right.
You know, I mean, I'm trying
But
to...
for her, she very vividly, you've done it hundreds, maybe
Right,
thousands of times.
right.
Her, she did it 5 times, and it's very vivid to her
Okay.
how she received what you presented as treatment, what she felt very different as.
Okay. And did she ever make any, I would assume not, otherwise I would know, you know, like concern, you know what I mean? Like, did I ever like ask her something and say like, does this hurt, and then not adjust it or not listen to what she was saying? You know what I mean? Like the feedback, would I respond to her feedback? And was she telling me she was getting better? Well then, yeah, I mean because that's how I'm asking, you know, like for feedback, I want to know, you know what I mean, am I helping, am I not helping, you know what I mean, and that's, and it's made, like I said, even with, be able to continue standing and walking and doing our job, you know what I mean, it is very personal, you know what I mean.
And it's also received very different when you're doing it on someone from the medical profession who has a lot more knowledge of what you're going to do.
Right. I can't talk about something I don't know the situation. You know what I mean, like from that long ago. But that's what I try. I do this all the time. You know, I talk to people. I'm trying to get feedback, and I'm trying to go off of their feedback. You know, and there's like this trust too on my part of that I'm trusting them to tell me if I'm hurting them, if I'm pushing too hard. Are they getting better? You know what I mean? Like that's part of the only way that I can really know, you know what I mean? It's like, is by having the feedback, you know what I mean? And I hope they said that I was asking them and trying to ascertain how their comfort level is, you know what I mean?
In some ways.
You know, because that's, the last thing I want to do is hurt someone, you know what I mean? And so if you're concerned because you're in their private area and you're asking them questions, and if they're not giving you the feedback, then how do you know that if you're saying, am I hurting you? And they say no, then how do I know that I'm hurting them? You know what I mean? And I'm trying to be realistic with them, you know what I mean?
And I understand that in a treatment, but in a different situation, and I think what concerns me here is the visible signs of your arousal, where this young girl is afraid.
Right. Well, I don't want people to be afraid, obviously. And I was trying to, you know, with my patients, I'm trying to actually help them, not hurt them. Okay? You know what I mean? That's, you know, that's the bottom line, I guess you could say. You know what I mean? Is that's my goal, you know what I mean, is to help them, not to hurt them.
And so, just to clarify, you're saying that during these visits, these treatments where you're dealing with young to old teenage girls who are very physically fit, very attractive, that you don't get aroused when you're touching. I mean, you're essentially touching their genitalia, touching their breast.
You know, I'm not purposely trying to get arousal from doing any treatment. I mean, come on. You know what I mean? I'm not purposely trying to gain some type of sexual gratification out of doing that. That's not what I'm doing. Okay, you know, if there was arousal, it's I mean, like it would be because of whatever, I don't know, but I'm not trying to. You know,
I don't know.
Well,
I don't know.
When you're a guy, sometimes you get an erection. You know what I mean? But I don't. That's
you get an erection when you're aroused.
You know, but you know what I mean. Like I'm just saying that you know I'm not trying to. How do you say this? And if I had an erection, I understand why I would have an erection from doing the treatment. You know what I mean? From what I'm doing. Okay. And that's rather embarrassing. You know what I mean? It'd be rather embarrassing. Okay. I mean, to have that happen. Okay. So it's just like, you know, that's not appropriate. Okay. And I don't. That is. just not professional. You know what I mean? I don't know how else to explain it, but that's, yes, you're a guy, but I'm trying to not, and yes, they're young ladies, but I'm trying my best to be professional. You know what I mean? That's why I'm talking with them too, is I want that feedback. I need that feedback, because if I don't, then how do I know that I'm her? If I'm in their area and I'm talking to them and asking them, you know what I mean? It's constantly asking them. You know what I mean? Like, then I feel like, okay, they're giving me the positive feedback. If they're not, I adjust. You know what I mean? So how can you not, if someone is telling you you're okay, how do you know you're not okay? I mean, like, if you're getting real time, are you okay? Is this helping you feeling better? Okay? And then if they say, so, if I'm not getting that feedback, how do I know that I'm not, but then I find out that I'm hurting them, that's bad feedback. That's not what, what I'm...
Do you do a similar adjustment or technique on male teens?
Yes, exactly. Whether they're male or female, it doesn't matter. You know what I mean? It's the same thing, because you're still having to treat the sacral tuberous or what have you. Yes. I mean, whether it's a male or female. Okay. Yes, and it's just what can I say? The thing that is most frustrating is that the amount of conversation that I'm trying to have with the patient to try and prevent this from happening, okay, is important. And if I'm asking a patient, does this hurt? Or is it helping? You know what I mean? And they don't tell me the truth. How do I know then that I'm hurting them? Mm-hmm. When I'm doing this real time, you know what I mean? Like, I want that feedback, and I adjust based upon the feedback. Mm-hmm. Okay? And I think that's the part that I'd like to, have some information about. You know what I mean? It's like that's the whole protective mechanism, so that I'm not harming someone, mm-hmm. So that there's real-time feedback.
Right. Okay. I understand what you're saying about the feedback, but I think there's a difference between physically hurting someone and then them feeling touched inappropriately.
Right, but
and I think that's a different scenario of a comfort level to give feedback.
But that's hurting, though. But that's hurting. Mm-hmm. If you're doing something inappropriate, that's hurting. That's not helping. You know what I mean?
Well, hurting mentally. But it may not be causing them physical pain to give you physical pain feedback.
Yeah, but there's a comfort level. If you're doing something and you're asking them.
Have you ever had someone do something that made you feel uncomfortable and you doubted saying anything?
Not, like you mean like.
Anything. It doesn't have to be physically anything. Where you thought, I don't feel right about this.
Yeah, you get your gut feeling. Yeah. I see what you're saying.
And your instinct was probably correct.
Your gut. Well, but that. I don't know. I'm just saying. Yeah, you have your sense. Everyone has like a sense about them. But.
I was going to give you a business card, and I realized that I don't have it. I'm going to go grab one and give you a moment to think and see if you have any other questions for me.
Yeah, I want to know what's going to happen. You know what I mean? Like I'm very.
I think similar to last time. Obviously, the university has to be notified. I have no control over that.
Right.
So I'm sure there will be conversations with your dean or whoever, however that looks. I'm sure you're familiar with that process. We don't get super involved in those processes. Right. But, and then I will continue to investigate.
Okay.
There will be other witnesses to talk to, things like that.
Okay.
And so like last time, there will be an investigation.
Right.
Okay?
Okay.
All right, I'm going to go grab a card. Just so that you can have my information. I'll be right back.
Okay.
read over their business card. So before I forget, I'll give you one of those as an email,
Okay.
and also the phone number that I left for you.
I don't know how to explain it more than what, I mean, like, I can't go back in time and remember that far, okay? But I'm telling you, honestly, it is, I'm trying my best to help the patient. I'm trying to get real-time feedback from them, okay? And I've helped so many people, that it hurts my brain to think that someone would, as I'm talking to them, I just don't get it, because I'm trying to prevent that. I don't want to hurt someone, so I'm trying to get real time. Am I helping? Am I not helping? And I try and adjust based upon what they're saying. And so it's hurtful for me to think that I've hurt someone. That's just not who I am. Okay, and I'm trying my best to figure out how I didn't read the situations, because that's, you're trying to assess comfort level, too, and I obviously offended her, there's no question, and that's not good, and I don't want to offend anyone, that's not the intent, that's not the purpose, and I'm trying to do the feedback to know if I'm making a difference or not, and so I usually leave feeling good because I'm helping someone,
What would you say if I told you that there may possibly be other complaints?
I'm doing this treatment a lot, so,
But why would there be those consistent complaints?
You work down there a lot, if I'm working there a lot, okay, what's gonna...
But if repeated girls are saying that you're not explaining the process and that...
But I feel I'm explaining the process. They may not be understanding it, but I think I was explaining the process. If I'm explaining it and they're not understanding it, then you would expect that they ask for more information.
Have you had other complaints from patients?
No, just the one, if I've had to explain things to patients,
But if they afterwards said, I feel like you invaded my space, but I violated...
No, nothing like that.
Okay. About how many times do you think you've done this procedure?
It'd be thousands, over the years, because it's been a long time. That I've been doing it, So, like I said, I lecture on it, and it is invasive. I'm trying to explain things, and that's what bothers me is that if I'm talking to people and asking them, for their feedback, and if I'm getting feedback that says it's okay, then it's okay. It's like I'm asking permission. Am I pushing on you too hard? Is it hurting? And I'm adjusting. And so that's the concern that I have is so this is just it hurts me to think that I'm not that by talking to my patients and trying to interact with my patients that I'm saying one thing and they're telling me something, but they're afraid to tell me the truth. And that's hard, okay? That they're afraid to tell me the truth. It's like, well, what's, just give me the feedback, and I adjust. That's the whole thing is getting that adjustment. That's what hurts. It's like, because it's like blindsiding someone. It's like if you're doing this and you're doing it for good to help someone, and they're giving you the positive feedback that you're helping them. How do I know I'm hurting them if I'm getting the positive feedback that I'm helping them? And they're telling me that. Like you said, she said, yes, it feels better, but she then wasn't feeling better. So how do I know that? Unless, so if you...
I think emotional pain, though, is different. And I think you keep talking about helping the physical pain, the cause that brought her there.
Right.
But emotionally, she's not getting help from this. She may be getting some physical because you are doing, in part, the treatment. Her pain is somewhere else.
Well, if she thought that I was being inappropriate, I could see how that would be painful. And I don't want that. That's why I'm trying to be you can explain something and then go ahead and treat it. But if you're actually talking to them while you're doing it, it's better than, in my mind, than saying, because I'm trying to get real-time feedback, not here's what I'm going to do, then I go do something different. If I'm actually touching the patient and asking for feedback while I'm touching the patient too, that allows for, in my mind, more, feedback than here's all the information, then you stop the information and you go do it, and then you don't get any feedback.
So if a patient stopped you and said, this feels inappropriate.
Yes, then of course I would adjust. I'd say I apologize and I'd try and explain more. Okay? This is what I'm doing, this is the reason why, that I'm doing what I'm doing. Okay? So you're gonna adjust and explain. You know what I mean? So yeah, if anyone says that it hurts or I feel uncomfortable, then say, okay, let's try a different way. Let's do this and I'll explain this. To them. Mm-hmm. So, I've done a lot of work with, I'm trying to also, if there was patients that I think needed more, I use a pelvic floor therapist. It's like if they need that type of help, I have a pelvic floor therapist that I'll send patients to. There was one patient who came up from that has and she'd had this problem with her. This was just in the past few months, and it's like, you're a peer, aren't you? Because gymnasts pee a lot. They have weak pelvic floor. And so we're always working like, okay, you got to learn how to use your pelvic floor to squeeze to help with the core. It's like the floor to the core. But anyways, so I was like, you have no tone down here. Are you a peer? And she goes, yes. And so I had her go to a therapist and gets intravaginal and intrarectal work, the pelvic floor, intravaginal, not intrarectal, but intravaginal work, and her spasms, her calmness went away, it changed again, it made a big difference for her, but that's when I use other therapists to help with that, okay, because that can make a difference, okay, but that's when I use those pelvic floor, the physical therapists that have training in pelvic floor work,
So do you stay in contact with a lot of your patients after treatment? A
lot of my patients, yeah, over the years, because they'll come back, I'll see them again, and for a different injury, or, yeah.
Do you initiate a lot of the contact with them?
No, I never initiate, they initiate the contact.
Okay. I don't really have any other questions right now.
Okay.
What's the best number to call you if I need to?
Let me give you my cell.
And if what you call. Okay. And that's my information. Like I said, I think that the Dean will probably want to speak with you soon.
Right.
Not something I can control.
Right.
But I may have more questions from you, and then I'll get a hold of you. So I don't have to call your home or your work.
Okay. All right. Well, thank you. I don't know what else to say, but I'm not trying to hurt anyone, and I must obviously not be doing a good job of explaining things. And I really feel like I'm trying to real-time explain things, and it's obviously must not have worked. So, but that's the best I can say, is that I'm trying to get real time, and if I'm offending someone, I would expect that as I'm treating someone, they would say that hurts or that makes me feel uncomfortable. And then you adjust and say, okay, I'm sorry, let me explain it to you, and you adjust. But if they give you positive feedback, then you think you're doing something that's helpful. But so, all right, well, thank you. I'm sorry. All right, well, have a good day.
Thanks, you too.